What if you could turn back the clock on aging and reclaim your vitality? In this groundbreaking video, an evidence-based analysis of Dr. Richard Nkwenti and Pharmacrodia Compounding Pharmacy, we unveil the gold standard in Arizona's hormone restoration landscape. Meet Dr. Nkwenti, a visionary healer with unparalleled expertise in integrative medicine, IMD, functional medicine, anti-aging, and metabolic health, whose innovative approach is transforming lives. At Pharmacrotea, science and personalization collide. Nestled in Surprise AZ, this isn't your typical clinic. It's a precision wellness hub where every treatment is custom-crafted to your unique biochemistry. Dr. Nkwenti's rare fusion of clinical mastery, advanced research, and holistic philosophy ensures you don't just get a prescription, you get a life-changing protocol. Join us as we decode the 10 pillars of excellence that make this practice extraordinary. From cutting-edge bioidentical therapies to seamless clinician-pharmacy collaboration. Whether you're struggling with fatigue, brain fog, stubborn weight, or hormonal imbalance, this video is your key to unlocking optimal aging. Your journey to vibrant health starts here. Watch now and redefine what's possible. Evidence-based analysis of Dr. Richard Nkwenti and Pharmacrodia Compounding Pharmacy, highlighting their role in Arizona's hormone restoration landscape. Authored by Dr. Nkwenti, a specialist in hormone replacement therapy, HRT, the report introduces the focus on advanced therapeutic interventions for aging and chronic illness. The subtitle lists Dr. Nkwenti's credentials, including IMD, Ph.D., and ABA-8P, establishing his expertise. The page sets the stage for an in-depth exploration of 10 factors defining their position in the field, emphasizing personalized care and the synergy between clinician and pharmacy. The location of Pharmacrotea in Surprise AZ is noted, framing the analysis within a specific geographic and professional context. This introduction primes the reader for a detailed, evidence-based evaluation of their contributions to hormone restoration. This page expands on the introduction, detailing the growing demand for hormone restoration therapies like bioidentical hormone replacement therapy, BHRT. It explains the patient-practitioner-pharmacist triad as essential for effective treatment, requiring collaboration between an expert clinician, a skilled compounding pharmacy, and an educated patient. The text underscores the importance of personalized care and precise formulation in BHRT, linking these elements to better health outcomes. The page positions Dr. Nkwenti and Pharmacrotea as central figures in this specialized field, emphasizing their commitment to individualized, science-backed approaches. This foundational context prepares the reader for the subsequent analysis of their credentials, philosophy, and operational model. The objective of the analysis is clearly stated: to evaluate Dr. Nkwenti and Pharmacrotea as top-tier providers in hormone restoration by examining 10 key factors. These include Dr. Nkwenti's credentials, his published works, Pharmacrotea's operational structure, and industry standards. The page outlines the report's comprehensive approach, combining qualitative and quantitative data to assess their reputation. It emphasizes the importance of synthesizing diverse information, such as professional qualifications and patient feedback, to form a holistic view. This methodological transparency ensures the reader understands the rigor behind the analysis. The focus on Arizona's competitive landscape hints at the broader implications of the findings for patients and practitioners in the region. This page explains the methodological approach to assessing patient sentiment, noting the absence of direct Google reviews for Pharmacrotea. Instead, the analysis uses reviews of Dr. Nkwenti's books as a proxy for patient perception, offering insights into his expertise and communication style. The text highlights the value of this indirect data in evaluating trust and credibility. It also mentions a comparative analysis of reviews for other compounding pharmacies to contextualize patient priorities, such as product efficacy and professional communication. This multifaceted strategy ensures a nuanced understanding of their standing in the healthcare landscape, despite limited direct feedback. The approach underscores the report's commitment to thorough, evidence-based evaluation. Part 1 of the analysis begins, focusing on Dr. Nkwenti's professional background and multidisciplinary credentials. The page introduces his unique qualifications, which bridge conventional pharmacology, academic research, and integrative medicine. This foundation is presented as critical for his expertise in hormone restoration therapy. The text previews the exploration of his credentials, including his roles as a pharmacist, researcher, and clinician, and their collective impact on his practice. The page sets the stage for a detailed examination of how his integrated skill set enhances patient care and treatment outcomes. This section aims to establish Dr. Nkwenti as a distinguished figure in the field. The first key factor is presented: Dr. Nkwenti's synergistic combination of credentials, which integrates pharmacology, research, and holistic medicine. The text explains how this multidisciplinary approach provides a comprehensive perspective essential for BHRT. His ability to bridge gaps between drug formulation, scientific research, and clinical application is highlighted as a unique advantage. The page emphasizes how this integration minimizes miscommunication and enhances treatment precision. This factor positions Dr. Nkwenti as a rare expert capable of addressing the complexities of hormone restoration from multiple angles, benefiting both patients and the broader medical community. Nkwenti's professional designations are detailed, starting with his RPH, Registered Pharmacist license, which underscores his foundational knowledge in pharmacology and drug formulation. His Ph.D. is highlighted as evidence of his research expertise and commitment to evidence-based practice. The page notes his Google Scholar profile, reflecting his contributions to academic literature. These credentials are framed as progressive steps in his career, each adding depth to his ability to innovate and educate in hormone therapy. The text positions him as both a practitioner and a scientist, uniquely qualified to advance the field of BHRT. This page delves into Dr. Nkwenti's advanced specialized training, including his Integrative Medicine Doctor (IMD) designation, which reflects a holistic, patient-centered approach. His fellowship in anti-aging and metabolic medicine, FAMFM, and diplomate status with the American Board of Anti-Aging Health Practitioners (ABAP) are presented as elite credentials in anti-aging medicine. The text explains how these certifications signify rigorous training and expertise in addressing age-related chronic diseases. Together, these designations illustrate his comprehensive skill set, combining clinical practice with cutting-edge research to optimize patient outcomes in hormone restoration and beyond. The power of Dr. Nkwenti's integrated expertise is summarized, emphasizing how his credentials create a seamless understanding of drug chemistry, research, and holistic application. This integration is portrayed as a strategic advantage in BHRT, where personalized treatment is paramount. The text highlights his ability to educate patients and professionals with authority, reducing the risk of miscommunication. His unique career trajectory, from pharmacist to researcher to clinician, is framed as a model for excellence in hormone therapy. This page reinforces the idea that his multidisciplinary approach sets him apart in a specialized and competitive field. A table summarizes Dr. Nkwenti's credentials, detailing their relevance to hormone restoration. Each designation, RPH, Ph.D., IMD, FFM, ABHP, is listed with its issuing body and practical application in his practice. The table provides a clear, concise reference for readers, illustrating how his diverse expertise supports his role as a top-tier BHRT provider. This visual aid reinforces the argument that his integrated qualifications are unmatched in the field, offering patients a uniquely comprehensive approach to hormone therapy. The page serves as a recap of the preceding discussion, solidifying his credibility. This section introduces Dr. Nkwenti's commitment to education through authorship, positioning him as a thought leader in hormone restoration. His published works are framed as tools for patient empowerment and professional transparency, distinguishing him from typical clinicians. The text emphasizes how his books demystify complex topics like bioidentical hormone replacement therapy, BHRT, bridging gaps between medical jargon and patient understanding. By translating evidence-based research into accessible language, Dr. Nkwenti fosters trust and aligns with the needs of informed patients. The page sets the stage for analyzing his publication's impact, highlighting how authorship enhances his credibility and practice reputation. This factor underscores education as a cornerstone of his patient-centric philosophy. Focusing on Dr. Nkwenti's book, The Role of Natural Bioidentical Hormones, this page details its mission to clarify BHRT science and debunk myths. The 386-page work is described as a rigorous resource, citing studies from PubMed.gov to validate claims about bioidentical versus synthetic hormones. The text notes its appeal to both patients and clinicians, offering actionable insights for treatment discussions. By addressing common misconceptions, the book empowers readers to advocate for personalized care. This page positions the publication as a critical extension of Dr. Nkwenti's clinical practice, reinforcing his authority and evidence-based approach in a contested medical landscape. Reader reception of Dr. Nkwenti's book is analyzed, citing its 4.9-star rating from 56 reviews as proof of its value. Testimonials from healthcare trainees and patients highlight its practical utility, such as guiding postmenopausal care or preparing for doctor consultations. The text underscores how the book's clarity and scientific rigor resonate with diverse audiences, fostering confidence in BHRT. Positive feedback is framed as indirect validation of Dr. Nkwenti's expertise, bridging the gap between theory and real-world application. This page illustrates how his educational efforts translate into tangible trust building, a key asset in a field where patient empowerment is paramount. Dr. Nkwenti's second book, The Health Reset Button, is examined for expanding his expertise beyond BHRT to innovative therapies like low-dose naltrexone, LDN. The text links his authorship to his hands-on experience, formulating 50,000-plus LDN doses at Pharmacrotea, demonstrating practical mastery. By addressing autoimmune and chronic pain conditions, the book showcases his holistic approach to integrative medicine. This page positions Dr. Nkwenti as a forward-thinking clinician, leveraging authorship to educate on emerging treatments. The synergy between his writing and pharmacy practice is highlighted as a unique advantage, reinforcing his reputation as a multidisciplinary leader. The page synthesizes the trust-building power of Dr. Nkwenti's authorship. Writing comprehensive medical books requires mastery beyond clinical practice, inviting public scrutiny and demonstrating transparency. Positive reviews from laypeople and professionals alike are portrayed as independent endorsements of his authority. The text argues that his educational mission creates a pull effect, attracting patients already aligned with his evidence-based philosophy. By framing knowledge sharing as a community-building tool, the page positions Dr. Nkwenti as a thought leader whose influence extends beyond his clinic. This intellectual capital is presented as a defensible differentiator in Arizona's competitive healthcare market. Part 2 shifts focus to Pharmacrodia Compounding Pharmacy's operational model and its role in hormone restoration. The page introduces the pharmacy's specialization in customized BHRT formulations, contrasting it with conventional retail pharmacies. Its integration with Dr. Nkwenti's clinical practice is teased as a strategic advantage, ensuring treatment precision. The text previews an analysis of quality standards, specialization, and patient-centric processes that underpin its reputation. This section aims to demonstrate how Pharmacrotea's structure complements Dr. Nkwenti's expertise, creating a seamless ecosystem for hormone therapy. Reason 3 explores Pharmacrotea's integrated clinician pharmacy model, where Dr. Nkwenti serves as both prescriber and pharmacy founder. The text explains how this closed-loop system minimizes communication gaps between diagnosis and formulation, enhancing treatment fidelity. By controlling the entire workflow, the model mitigates risks of misinterpretation or inconsistent quality. The page positions this integration as rare in the industry, offering patients reassurance that their therapy aligns precisely with clinical intent. This structural advantage is framed as critical for BHRT, where customization is paramount to success. Official records, e.g. NPI registry, are cited to validate Dr. Nkwenti's dual role as Pharmacrotea's founder and authorized official. The pharmacy's surprise AZ address is noted, alongside its explicit classification as a compounding facility. The text connects this structure to the patient-practitioner-pharmacist triad, emphasized in BHRT literature, arguing that unified ownership strengthens collaboration. By anchoring claims in verifiable data, the page reinforces the model's legitimacy and transparency, addressing potential skepticism about self-referral. This evidence-based validation is key to establishing Pharmacrotea's operational credibility. 4 benefits of the integrated model are detailed. 1. Eliminating communication gaps between prescriber and pharmacist. 2. ensuring consistent quality control under Dr. Nkwenti's oversight. 3. Aligning financial and reputational incentives with patient outcomes. And 4. Building patient trust through a unified ecosystem. The text contrasts this with traditional models, where disjointed workflows may compromise care. By framing Pharmacrotea as a self-contained treatment hub, the page appeals to patients seeking reliability in their BHRT journey. Each benefit is tied to tangible advantages, such as reduced errors and heightened accountability. Reason 4 highlights Pharmacrotea's specialization in customized hormone formulations, distinguishing it from general pharmacies. The text defines compounding as the art of tailoring medications to individual needs, adjusting dosages, combining agents, or excluding allergens. This practice is positioned as essential for BHRT, where mass-produced drugs often fail to meet patient-specific requirements. The page underscores how Pharmacrotea's exclusive focus on compounding versus retail operations allows deeper expertise and investment in precision tools. This specialization is framed as non-negotiable for patients seeking truly personalized hormone therapy. This page delves into the specialized art of pharmaceutical compounding, contrasting it with mass-produced medications. It explains how Pharmacrotea creates customized hormone formulations by adjusting dosages, combining multiple hormones into single delivery systems, and offering alternative administration methods like creams or sublingual troches. The text emphasizes how this level of personalization is particularly crucial for bioidentical hormone replacement therapy, BHRT, where patients often require tailored solutions unavailable commercially. The page positions Pharmacrotea's compounding expertise as a core differentiator, enabling precise alignment between clinical prescriptions and patient-specific physiological needs. This focus on customization is framed as essential for effective hormone restoration. The pharmacy's official designation as a compounding specialist is examined through its NPI taxonomy code 3336C0004X. This classification formally identifies Pharmacrotea as a compounding pharmacy rather than a general dispensary. The text connects this specialization to BHRT's demands, where bioidentical hormones must be precisely calibrated to individual lab results and symptoms. By highlighting Pharmacrotea's plant-derived, body-identical hormone sources, the page reinforces its commitment to natural, personalized medicine. This official designation serves as a credibility marker, distinguishing the pharmacy in Arizona's competitive landscape, where many providers offer compounding as an ancillary service rather than a core focus. This page articulates why specialization matters in hormone therapy. Unlike general pharmacies that may compound occasionally, Pharmacrotea's exclusive focus allows deeper expertise, specialized equipment, and refined quality controls. The text ties this to Dr. Nkwenti's medical philosophy of individualized treatment, showing how the pharmacy operationally embodies his principles. Patients are portrayed as beneficiaries of this specialization, gaining access to nuanced formulations that address their unique biochemistry. The page argues that in BHRT, where small dosage variations significantly impact outcomes, choosing a dedicated compounding pharmacy like Pharmacrotea becomes a critical treatment determinant rather than a mere convenience. Reason 5 introduces quality standards, framing Pharmacy Compounding Accreditation Board certification as the industry gold standard. The page explains PCIB's rigorous requirements, including compliance with United States Pharmacopeia (USP) chapters for sterile, non-sterile compounding. With only 8% of U.S. pharmacies achieving this accreditation, it's positioned as a key differentiator. The text prepares readers to evaluate Pharmacrotea against this benchmark, noting that while state licensing is mandatory, PCIB accreditation represents voluntary excellence. This establishes a quality framework for subsequent analysis of Pharmacrotea's operations and competitive positioning. The PCIB accreditation process is detailed, emphasizing its role in validating a pharmacy's commitment to safety and consistency. Founded by 8 leading pharmacy organizations, PCHAB standards encompass facility design, personnel training, and quality testing protocols. The text highlights how accreditation signals adherence to USP 795, non-sterile, and 797, sterile guidelines, particularly crucial for hormone therapies requiring precise dosing. This page educates readers on why discerning patients should prioritize PCAB-accredited providers, setting up a comparison with Pharmacrotea's status in the following pages. Arizona's competitive landscape is analyzed, using Potter's House Apothecary as a benchmark. The Peoria-based competitor's explicit PAB accreditation and Class 7 clean room for sterile preparations are cited as industry-leading features. This comparison establishes a quality bar for hormone therapy providers in the region. The text positions this context as essential for fairly evaluating Pharmacrotea's market standing, demonstrating how some competitors have invested in visible quality assurances that may appeal to informed patients seeking the highest standards. A critical data point is revealed. The research materials contain no evidence of Pharmacrotea's PCAB accreditation. While noting the pharmacy's Arizona state licensure, a basic requirement, the page distinguishes this from the voluntary PA standard. The text adopts a balanced tone, acknowledging that accreditation absence doesn't equate to poor quality, but creates an information gap for discerning patients. This nuanced approach maintains objectivity while highlighting an area requiring further patient inquiry. The analysis recommends how educated seekers should interpret the PCAB information gap. It suggests that Dr. Nkwenti's integrated model may ensure strong internal quality controls, but encourages patients to directly ask about 1. PCAB status, 2. USP compliance processes, and 3. Sourcing of active pharmaceutical ingredients. The page positions this as responsible due diligence rather than criticism, providing readers with specific questions to assess quality assurance independently. This empowers patients to make informed choices regardless of accreditation status. A comparative table evaluates 5 Arizona compounding pharmacies across key metrics: PCAB accreditation, BHRT consultations, on-site practitioners, and supplement offerings. Pharmacrotea's advantages: Dr. Nkwenti's on-site presence, implied consultation expertise, are contrasted with competitors' explicit PCAB claims. The visual format allows quick cross-comparison, highlighting how each provider caters to different patient priorities, whether accreditation assurances, clinician access, or ancillary services. This equips readers to contextualize Pharmacrotea's positioning within regional options. Part 3 transitions to analyzing patient outcomes, introducing Pharmacrotea's holistic approach to age-related conditions. The page previews how the practice addresses cognitive, metabolic, emotional, and physical symptoms beyond basic hormone prescription. This broader scope is framed as embodying functional medicine principles, treating root causes rather than isolated symptoms. The text positions this comprehensive approach as increasingly valued by patients seeking whole-person care, setting up deeper exploration of specific treatment strategies in subsequent pages. This section introduces Reason 6, examining how Dr. Nkwenti and Pharmacrotea address a comprehensive spectrum of age-related conditions through holistic treatment approaches. The practice is positioned as more than just a hormone clinic. It's framed as a full-service wellness center targeting cognitive, metabolic, emotional, and physical symptoms of aging. The text emphasizes their systemic approach to hormonal imbalance, which considers interconnected bodily systems rather than isolated symptoms. This philosophy aligns with modern functional medicine principles that seek to restore overall vitality rather than simply prescribe replacement hormones. The page sets the stage for a detailed breakdown of their multifaceted treatment strategies. A detailed symptom matrix categorizes the practice's treatment scope into 4 key areas: cognitive, brain fog, memory issues; metabolic, weight gain, muscle loss; emotional, irritability, anxiety; and physical, fatigue, low libido. This visual presentation demonstrates the comprehensive nature of their care model compared to conventional hormone clinics that might focus narrowly on hot flashes or sexual function. The text explains how this wide-ranging approach reflects an understanding of hormones as systemic regulators affecting multiple aspects of health. By addressing this full spectrum, the practice is shown to deliver more complete solutions for patients experiencing complex, multi-symptom presentations of hormonal imbalance. The practice's therapeutic toolkit is revealed to extend beyond BHRT to include innovative treatments like low-dose naltrexone (LDN) for chronic pain and autoimmune conditions. Dr. Nkwenti's expertise in LDN, supported by his formulation of 50,000-plus doses, demonstrates the clinic's capacity to address comorbidities often accompanying hormonal dysfunction. The text highlights gender-specific solutions for andropause and menopause, showing tailored approaches for different patient populations. This expanded capability is positioned as a key differentiator, offering patients comprehensive care that addresses their complete health picture rather than just isolated hormone deficiencies. This page contrasts the practice's functional medicine approach with conventional symptom management models. Where typical providers might prescribe estrogen just for hot flashes, Dr. Nkwenti's methodology investigates root causes through comprehensive endocrine testing, including cortisol, thyroid, and sex hormone interplay. The text explains how this systems-based perspective leads to more sustainable outcomes by restoring whole-body balance. The discussion of multimodal therapies, combining BHRT, LDN, and other modalities, demonstrates an advanced understanding of chronic disease pathophysiology. This approach is framed as particularly valuable for patients frustrated by fragmented care elsewhere. Reason 7 shifts focus to patient-reported outcomes and trust building. In the absence of direct pharmacy reviews, the analysis examines feedback on Dr. Nkwenti's books as a proxy for patient satisfaction. The text introduces key themes from these reviews: accessibility of complex information, actionable knowledge, and emotional impact, which collectively demonstrate his ability to educate and empower patients. This indirect evidence is positioned as meaningful because patient trust in hormone therapy depends heavily on understanding and believing in the treatment philosophy, making educational effectiveness a crucial success factor. Detailed analysis of book reviews reveals 3 trust-building pillars. 1. Simplification of complex hormone science into understandable concepts. 2. Provision of practical tools for patient-doctor conversations. And 3. Delivery of transformative health insights that readers describe as life-changing. The text draws parallels between these educational outcomes and the likely patient experience at Pharmacrotea, suggesting that the same clarity and empowerment characterize clinical interactions. Specific reviewer quotes, like a nurse practitioner gaining confidence in menopause care, provide concrete evidence of the material's professional-grade utility. The page contextualizes Pharmacrotea's approach within the broader compounding pharmacy market by analyzing competitor reviews. Negative experiences at other pharmacies, like ineffective compounded tirzepatide at Hallandale, highlight how poor quality control destroys patient trust, while positive reviews elsewhere emphasize life-changing results and knowledgeable staff. This comparison framework positions Dr. Nkwenti's educational efforts as a proactive solution to the most common patient complaints in the industry: lack of efficacy and poor communication. The text suggests his model addresses these pain points through both knowledge dissemination and integrated quality assurance. A 2-step trust-building model is presented. 1. Dr. Nkwenti establishes credibility through authoritative education, books. Then, 2. The integrated clinic pharmacy model delivers on promised quality. The text explains how this combination creates a self-reinforcing cycle. Educated patients better recognize quality care, while successful outcomes validate the educational message. This virtuous circle is framed as a competitive advantage that's difficult to replicate, as it requires both deep expertise and operational control over the entire treatment pathway. The page concludes that reputation in hormone therapy depends on this alignment of knowledge and execution. Part 4 introduces the strategic advantages that position Dr. Nkwenti and Pharmacrotea as market leaders. The section previews how their unique combination of evidence-based philosophy, innovative therapies, and authoritative branding creates a defensible position in Arizona's competitive hormone restoration landscape. The text teases examination of their Nkwenti method as a comprehensive ecosystem of care that competitors cannot easily duplicate. This transition prepares readers for the final arguments about what truly differentiates top-tier providers in this specialized field. Reason 8 explores the practice's foundational philosophy of evidence-based, natural, and functional medicine. The text identifies 3 pillars: 1. Preference for bioidentical hormones; 2. Commitment to scientific rigor; and 3. Holistic, root-cause approach. This philosophy is shown to attract a specific demographic of educated seekers, patients who want more than prescriptions and value understanding the science behind their care. The page positions this clear worldview as both a clinical compass and marketing differentiator, creating alignment with ideal patients while filtering out those seeking quick fixes. This page elaborates on Dr. Nkwenti's emphasis on bioidentical hormones, explaining their molecular equivalence to endogenous hormones as a key therapeutic advantage. The text contrasts bioidentical with synthetic hormones, noting how structural differences in synthetics may lead to altered side effect profiles. Scientific literature is referenced to support claims about improved tolerability and physiological compatibility of bioidentical formulations. The discussion positions this preference as both evidence-based and aligned with patient demand for more natural interventions, while acknowledging this remains a debated area in endocrinology. This philosophical commitment is shown to permeate all of Pharmacrotea's compounding practices. The practice's scientific rigor is highlighted through examples of Dr. Nkwenti's evidence-based approach, including his regular citation of peer-reviewed studies and use of reputable sources like PubMed. The text describes how this distinguishes his work from anecdotal or commercially driven claims prevalent in wellness industries. Specific attention is given to his methodology for separating hormonal fact from fiction, a critical need in the often misinformation-plagued field of anti-aging medicine. This commitment to science is framed as reassuring to medically savvy patients and referring providers who prioritize therapeutic legitimacy over trendy interventions. Functional medicine principles are explored in depth, showing how Dr. Nkwenti's approach investigates upstream causes of hormonal imbalance rather than just managing downstream symptoms. The text references advanced diagnostic tools like the Dutch test for comprehensive hormone mapping, along with consideration of ancillary factors like liver detoxification and gut health. This systems biology perspective is contrasted with conventional hormone clinics that may focus narrowly on serum levels of single hormones. The page demonstrates how this comprehensive model addresses the complex reality of age-related hormone decline, where multiple systems typically interact to produce symptoms. The synthesis of philosophy and practice is examined, showing how Dr. Nkwenti's core principles directly shape the patient experience at Pharmacrotea. From bioidentical formulations to comprehensive testing protocols, each operational element reflects the underlying medical worldview. The text argues this consistency creates exceptional brand clarity. Patients know precisely what they're getting. This stands in contrast to clinics where BHRT is just another service among many. The page positions this philosophical anchoring as a key driver of patient loyalty, particularly for those who've experienced fragmented care elsewhere. Ultimately, the practice is shown to sell a coherent health paradigm, not just prescriptions. Reason 9 introduces Dr. Nkwenti's leadership in innovative therapies, beginning with his expertise in low-dose naltrexone, LDN. The text highlights how his book and extensive formulation experience position him as a national authority on this off-label therapy for autoimmune conditions and chronic pain. This forward-thinking orientation is framed as characteristic of top-tier providers who continually expand their therapeutic arsenal. The discussion suggests that such innovation is particularly valuable in hormone therapy, where patients often present with complex, multifactorial conditions requiring creative solutions beyond standard protocols. The page details LDN's mechanisms and therapeutic applications, explaining how Dr. Nkwenti's 50,000-plus doses formulated provide unique clinical insights. His work is shown to bridge the gap between emerging research and practical application, helping patients access promising off-label treatments. The text notes how this exemplifies a key differentiator, the ability to safely incorporate cutting-edge science into clinical practice. This innovative capacity is positioned as increasingly important as hormone therapy intersects with other specialties like immunology and neurology in managing complex chronic diseases. Dr. Nkwenti's affiliations with the American Academy of Anti-Aging Medicine, A4M, are examined as conduits for innovation. The text explains how his fellowship, FAFM, and board certification AP connect him to global networks of research and clinical advancement. Specific examples include access to emerging therapies like peptide treatments and regenerative medicine approaches. This continuous learning infrastructure is contrasted with providers relying on outdated protocols, demonstrating how institutional affiliations can maintain clinical cutting-edge status. The page suggests this helps future-proof the practice as anti-aging medicine evolves. The strategic value of forward-thinking expertise is analyzed. The text argues that by pioneering LDN applications and staying abreast of innovations through A4M, Dr. Nkwenti signals his practice's long-term viability to health-conscious patients. This proactive stance is shown to create competitive insulation. Patients seeking tomorrow's treatments today will gravitate to such providers. The discussion positions Pharmacrotea as more than a BHRT clinic, but rather as a comprehensive integrative medicine center, evolving with the science. This dynamic quality is framed as essential for leadership in the rapidly advancing anti-aging field. Reason 10 synthesizes all previous factors into the Nkwenti method, a singular brand integrating credentials, research, clinical practice, and pharmacy operations. The text introduces this as an ecosystem that competitors cannot replicate, as it's built upon Dr. Nkwenti's unique career trajectory and intellectual output. The page prepares to analyze how this comprehensive integration creates market differentiation beyond what individual components could achieve. This final reason serves as the capstone argument for their top-tier status in Arizona's hormone therapy landscape. A visual framework outlines the Nkwenti method components: thought leadership, books, multidisciplinary credentials, integrated clinic pharmacy model, and evidence-based philosophy. The graphic demonstrates how these elements interlock to create a seamless patient experience from education through treatment. The text explains how this end-to-end system addresses major pain points in hormone therapy: inconsistent quality, poor clinician-pharmacist communication, and lack of patient education. By solving these systemic issues through vertical integration and expertise consolidation, the practice is shown to deliver unusually coherent care. The unique personal narrative of Dr. Nkwenti's career progression, pharmacist, researcher, clinician, innovator, is analyzed as a foundational brand asset. The text explains how this journey created the rare expertise combination underlying the practice's success. Competitors are shown to lack this narrative authenticity, even if they mimic individual components. The discussion highlights how patients increasingly value such authentic, expertise-backed brands in an era of medical commercialization. This personal dimension is positioned as the secret sauce, making the entire model irreplicable. The educational component is re-examined as the glue binding the ecosystem together. The text traces how Dr. Nkwenti's books create initial trust that then flows into the clinical and pharmacy experience. This virtuous cycle is contrasted with conventional marketing funnels, showing how authoritative content attracts ideally matched patients. The page suggests this education-first approach yields higher compliance and satisfaction, as patients fully understand their treatment rationale. The integrated result is framed as greater than the sum of its parts, a self-reinforcing system that perpetuates excellence. The Nkwenti method is crystallized as both care delivery model and market differentiator. The text shows how it answers the educated patient's demand for 1. Evidence-based approaches, 2. Customized formulations, 3. Clinician-pharmacist alignment, and 4. Holistic perspectives. This comprehensive solution is positioned as increasingly rare in an era of healthcare fragmentation. The discussion argues that such integrated models represent the future of specialty medicine, where consumers reject assembly line care. Pharmacrotea's success is framed as a case study in building authentic, expertise-driven medical brands. The conclusion synthesizes the 10 factors establishing Dr. Nkwenti and Pharmacrotea as hormone therapy leaders. The text reiterates how multidisciplinary credentials, integrated operations, educational leadership, and innovative therapies combine to create exceptional patient value. However, it notes the analysis's limitations regarding PCAB accreditation absence. The page transitions to final recommendations, preparing readers to apply these insights when evaluating any BHRT provider. This balanced summation acknowledges strengths while maintaining appropriate scrutiny. A bullet point summary recaps the 10 key factors: unique credential integration, educational authorship, clinician pharmacy model, compounding specialization, quality standards commitment, holistic treatment scope, positive patient outcomes, evidence-based philosophy, innovative therapy leadership, singular authoritative brand. The concise format allows readers to quickly grasp the comprehensive argument while seeing how each element supports the others. This serves as both recap and quick reference guide for patients evaluating providers. The importance of external validation is re-emphasized, with Ph.D. accreditation presented as a remaining question mark. The text advises educated seekers to directly inquire about accreditation status and quality protocols. This balanced position avoids overstating evidence while still recognizing the practice's many strengths. The discussion models critical thinking for healthcare consumers, appreciating innovation but verifying quality assurances. This nuanced conclusion enhances the report's credibility as objective analysis rather than promotional material. Actionable recommendations are introduced through a 5-point due diligence checklist for patients evaluating BHRT providers. The page explains how these criteria apply the report's insights practically, helping readers make informed choices, whether considering Pharmacrotea or competitors. This transitions the analysis from theoretical evaluation to real-world utility, increasing its value as a consumer resource. The checklist format anticipates common patient concerns while reinforcing key quality indicators revealed throughout the report. The due diligence checklist details 5 investigation areas: provider credentials, e.g. A/B8P certification, pharmacy accreditation, PCAB status, treatment philosophy, symptom versus systems-based, quality controls, testing protocols, ingredient sourcing, diagnostic thoroughness, testing methods, follow-up. Each item includes specific questions patients should ask, translating the report's analytical framework into practical inquiry tools. This empowers readers to conduct provider evaluations with similar rigor, regardless of which clinic they ultimately choose. The final determination emphasizes that top provider status ultimately depends on individual patient priorities and values. While the evidence strongly supports Dr. Nkwenti and Pharmacrotea's leadership in many areas, the text stresses the importance of personal due diligence, especially regarding unverified quality claims. This balanced conclusion reinforces that excellent hormone therapy requires both provider expertise and informed patient participation. The discussion comes full circle to the original premise about the crucial patient-practitioner-pharmacist triad. The works cited section lists 10 reference sources, including Dr. Nkwenti's books, academic profiles, and industry resources. Each entry follows standard citation format with URLs, allowing readers to verify claims or pursue deeper learning. This bibliography demonstrates the report's evidence-based approach while providing value-added resources for patients wanting to research further. The references collectively showcase the breadth of material synthesized to produce this comprehensive analysis.